excuse yourself, you're gonna have to get a unit of blood, the doctor's ordered, and I'm gonna go to the lab and go retrieve that.
Okay, verifies that informed consent has been obtained. Remember, you've got to get written permission.
So I'm gonna check the chart and be sure that I do see a blood consent there. If there's not a signed blood consent, I will go to the patient and get that done.
Administer any pre-transfusion medications if ordered.
Sometimes they may order Benadryl, Lasix between units or something like that. If there's any specific orders for that, I will administer those.
Okay, obtain an IV fluid containing normal saline.
Okay?
This is what you're gonna flush with.
So that one saline,
And a blood administration seal.
the blood administration set.
Okay, obtain the blood product from the blood bank.
Okay? I don't have to open that right now. I think they'll probably tell me when to do that.
So it depends on the facility, remember. Some of them you will take a label with you, some of them you'll take something, some kind of requisition or whatever. Facilities are different, so you'll do what they do, but you'll go to the blood bank lab, and the blood bank person is gonna verify the blood with who comes to pick it up.
Right.
Okay, now we're going to the patient's bedside with another qualified staff member.
Okay?
Now, we're gonna have a sheet that the lab is going to give us. It's gonna have all of this on here. Right, tell them what we're looking
Okay.
for.
So, the unit number is DR 25899. The patient's name is Joe Smith. His date of birth is 6/12/65. He has no allergies. This blood unit expires 10/2/16, A positive.
Okay, so everything checks out. And then if he's got a blood bracelet on, we will also check that as well.
So verify his blood number with the blood number that's also gonna be on the label. I think it's gonna be on the sheet.
If all verifications are in agreement, both staff members will sign the sheet saying we verified it.
Right.
All right. Obtain a full set of vital signs, your baseline vital signs. So go ahead and bring a vital sign machine in with you to get their baseline before you ever hang it. If they're running a fever or anything like that, which this would be a good thing to do before you go to the lab, because if you go back in the room and they're running 102 fever, we can't give them blood. And remember, we only got 30 minutes to get it back to the lab. Remember, don't put it in the refrigerator on the floor. It's not made for that.
So when you go in and introduce yourself, tell them what you're doing, could you go and get vitals at that
Well, you know,
point?
if you were going to get the written consent, you could take the vital signs then and get the baseline. And then if there were any problems, you would know I can't go get my blood. Okay. So we're getting the vital signs. And we're going to put that on our blood administration sheet, which now is in the computer, and that sort of thing. Okay, remove the blood administration set from the package. And it says you can label it with the time and date that you're using this. How long can a one bag hang? 4 hours. How many can you give if it's running in an hour and a half or 2 hours? You can give 2 units through that same tube, but not over that. Okay? All right, clamp the clamps, close the clamps. There's 2 of them.
And there's a bunch. Yep.
This is called a Y set. So one port is gonna be for the saline, one port's gonna be for the blood. Okay, so close all of your clamps. Remove the protective cover from the normal saline port and spike the Y of the blood administration set. So you're going to prime with saline.
And there's not one designated for saline and one designated for blood there.
Hang the normal saline on the pole. Compress the drip chamber till it fills halfway. cover your filter.
Okay.
Prime the administration set with the normal saline.
All the way down.
Be sure your filter is covered with saline, which you did.
And stop.
Gently invert the blood bag several times to mix the blood. Okay. She's ready. Okay. Using aseptic technique, attach the blood administration tubing to the bag.
Would you have gloves on doing this?
You could, I mean, but
Yeah.
you don't want to spike that bag, and I have seen people actually break the bag because they were too, and the blood went everywhere, and that's a very expensive bag of blood. By the way, just because it's a donor bag doesn't mean it's free to the patient. They still have to pay for all the processing and everything on blood. So.
And you need to be sure you clamp off the saline and open the clamp for the blood. Otherwise, you see I got a little pink in there. You could get blood backed up in that bag too, so be sure you clamp that off.
Okay, so you're gonna attach your tubing to the patient. We're gonna start the administration at a slow rate. So we usually start it at about 50 mils an hour, whatever, because remember, when are they gonna get a reaction usually?
Put in
The first 10 milliliters. So we're going slow. Remain with the patient during the first 15 to 20 minutes, observing for any adverse reactions, and you're obtaining vital signs every 15 minutes times 2. So you're watching to make sure their temperature is not going up, nothing's happening with their blood pressure, they're not having any hives, itching, shortness of breath, the flank pain, none of that. Okay. Obtain the vital signs every 30 minutes times 2 after that. Then obtain vital signs every hour till finished. Each unit should not hang over 4 hours. All right. After the unit finishes, flush the tubing with normal saline. So this red bag's going to be empty. You're going to close that clamp. And you're going to open your saline and let them get the rest of the blood that's in the tubing. Okay, if another unit is required, you go through the same administration process.
I'll just clamp this off, and all I would have to do is just remove this empty blood bag, put the new one in there, hang it up,
Start new vital
start
signs.
new vital signs, because a new bag, a new reaction could occur.
So we would repeat everything from verification on down, just like we did. Okay, follow steps for second unit 5 through 26. Discard the empty blood package and administration set according to the agency policy.
And there's usually a red container that says blood bags only, typically.
Yes. Okay, if you get a reaction, stop the infusion immediately. Obtain their vital signs. Who else have you got to tell? You've got to notify the doctor that they've had a reaction. Do not flush the tubing because you're going to give them that blood. So you don't want to start them. You don't want to flush with this saline. You want to take this whole set down and prime a whole new thing of normal saline down. In case you have an emergency, you have to give them epinephrine or something, IV push. Maintain the patient's IV with the new IV tubing set up to 30 to 50 milliliters. Notify the doctor immediately. Advise them of the vital signs and the symptoms of the blood reaction. Place the blood tubing and unfinished blood into a bag and return to the blood bank. Remember, they're going to have to run tests on it to see why there was some problem with the cross match. Okay, order labs and obtain urine. A lot of times they want to catch a urine to see if there's any kidney damage. Remember, if there's a reaction, a lot of times it starts blood clotting as it goes through the kidneys, and so they're going to have some urine tests and things but that's gonna be facility, you're gonna know. Monitor their vital signs frequently, administer any medications the doctor tells you to, so if you're given Benadryl or epinephrine or anything like that, you've got to administer that and document it. And then document the whole reaction in your notes, and there's usually an incident report for blood reaction. So, and you'll have to fill that out and give that to your charge nurse on the floor and then, or the unit manager. And there may be a copy you have to take to the blood bank. So that's administering blood.
So it's a lot more discussion than it is.
Verbalizing, a lot of verbalizing.
Yeah.